everyone. So today I wanted to create another video about PCOS. I wanted to discuss natural approaches to treat PCOS versus more medical approaches. So what do I mean by natural approaches versus medical approaches? Natural approaches, I mean things like lifestyle changes. So changing your diet, changing the way you exercise, changing your stress management, eating specific supplements. That's what I mean in terms of natural approaches. When I'm talking about medical approaches, I'm talking about things like metformin, birth control pills, spironolactone, drug treatments to conceive, fertility treatments. I'm talking about what you would get if you were to see your family doctor or a gynecologist or endocrinologist or something like that. So that's what I mean when I'm talking about more natural approaches versus more medical approaches. And what I find unfortunate is that and that is the case with a lot of things, not just with PCOS treatment, but in life, people tend to make things black or white, and then people tend to stick with one idea and then think that anything from the opposing idea isn't good. But I think that with almost everything, things aren't black and white. They're usually gray. They're usually more in the middle, which is why my channel is called The Healthy Middle. And I think it's just a matter of figuring out what your specific needs are and really understanding what different treatments or different approaches can give you, really by being informed and asking the right questions and getting the proper support with professionals. And then based on all of that information and your knowledge of yourself, making the best decision for you, which isn't going to be the same for me or for someone else or for someone else, right? So today I wanted to touch a little bit on what you can expect with natural approaches, what you can expect with meds, and how to decide what's the best treatment option for you. So in terms of my story with PCOS, when I was first diagnosed with PCOS, I was really adamant to try to get this sorted out naturally as much as possible. And I think there's many reasons for that. I think first of all, it's because it was the first time that I was diagnosed with any health condition, and I didn't like the idea of, having this label, of being stuck with this condition. And I figured if I can just change something to my lifestyle and make it go away, that would be great. But there's also other reasons why I went more a little bit on the natural side. So the advantages of the natural approaches to treating PCOS is if you're only using natural approaches and you're not using meds, one of the advantages of that is that you can kind of see what the impact of these changes are, because you can really see your symptoms. Whereas if you're taking, for example, if you're taking the birth control pill, okay, and then you're also making changes to your lifestyle, like changing how you eat, changing how you exercise, or other things, then it can be hard to know what the impact of that is on your cycle, because your cycle is already affected by the birth control pill. So that would be like one advantage of going totally natural. But I don't think that there's only advantages to trying to deal with your PCOS only in a natural way. So like I said, so those are the advantages. You can, when you're only doing natural things, you can really see how your treatments, how your symptoms are affected by that, because they're not being modulated by anything else. However, when it comes to changing your health through lifestyle changes, whether it be your diet, like I said, your exercise, supplements, better sleep, changing how you manage your stress, etc. The thing is that these natural approaches usually take a lot of time before you actually see improvements, and there can be a lot of trial and error before you actually see the benefits of it. So for example, in my case, changing my diet and supplementing with Ovasitol did help with the period. So I was able to gain my period back within but it did take about maybe I would say 3-4 months or so. However, I still continued struggling with a lot of hair loss, with acne, and it probably took me years to really figure out what was going on with my body, figure out that I had some food sensitivities, like I have celiac disease and I am very sensitive to dairy, and this is what is making my acne a lot worse. So it probably took me years before I actually figured out how to change my lifestyle to really modulate those symptoms. So that can be a really long time. And if you are feeling very sad about your symptoms, or you're in pain, or you're feeling very depressed, putting all of that energy and effort to kind of change your habits, change your lifestyle, and do all of these trials and errors can be very lengthy. And you can suffer a lot through the process until you figure things out. So sometimes I think about it and I ask myself, I'm happy that I did it naturally, because, not taking anything else, like I said, really allowed me to see how my symptoms would change and how my body would react to certain changes I would make to my lifestyle. But on the other hand, I did suffer a lot. I was feeling very, very self-conscious, and the acne is somewhat painful to some extent, when you have some in your back and you lean on a chair. And the hair loss also was kind of affecting my confidence a lot. So sometimes I wonder, should I have just maybe taken some of the medical help, whether it be the birth control or spironolactone, which was maybe what was more recommended in my specific case, and then try to figure out all of the lifestyle changes, and at the same time at least I get some relief from my symptoms. So that's really what you have to ask yourself. You have to ask yourself, how am I feeling right now? How bad are the symptoms making me feel? If you're feeling really, really depressed and the symptoms are really, really hurting you, or you have pain, or you're feeling very self-conscious, then perhaps getting the medical help first to help you with that, and then also on top of it, making changes to your lifestyle. Maybe that's the best approach for you. It really depends on how you're feeling, how patient you are. If you're someone really impatient who wants to see results quickly, that is definitely an advantage of all of the medical treatments. So the medical treatments, you will usually see the results much quicker than with any natural approach. Why? Because with the natural approaches, you have to make consistent changes. You have to change your habits. Like I said, there's a lot of trial and error. So that takes a lot of time before you can consistently change your habit and your body can actually change, and then you'll see the results. With the drug, it's a more immediate effect because the drug is going to directly target specific things. So that's one of the advantages of the drugs, is that usually you'll have symptom relief that is a lot quicker, and that involves a lot less work, a lot less changing what you're doing, figuring things out. So that's a big advantage of the drugs. However, a disadvantage of the drugs compared to the natural approaches is that, first of all, the drugs, a lot of them have side effects. So you want to be informed of what those side effects can be, if that is a risk that you're willing to take, and of what type of medical follow-up that you're going to be needing. For example, I know that with spironolactone, you need to have regular blood work done. I believe it's to make sure your potassium levels or something like that stay under control. So you have to, once again, be informed, ask questions, ask your doctor about it when they want to prescribe something to you. How many benefits am I going to get from this, or how much benefit? How quickly is it going to help me? What are the side effects? Do I need to be monitored when I'm on that drug? What are the long-term consequences of taking that? So those are all questions you want to ask, once again, to make an informed decision, because like I said before, everybody's different and the right solution isn't the same for everyone. It really depends on your priorities, how you're feeling at that point, your symptoms, because once again, we don't all have the same symptoms. The severity isn't the same. So you want to really make sure that you're making the best choice for you. So basically, in summary, if you are someone who has symptoms that are a little bit milder, and you're not really under any physical or mental intense pain, or it's tolerable enough, then probably going just on the natural approach side and trying to make lifestyle changes and being able to see how that changes your symptoms, maybe that's the best option for you. If right now you're really struggling with your symptoms and it's making you very unhappy or very uncomfortable, perhaps taking the medication, but on top of it, making lifestyle changes, perhaps that is the best solution for you. If the symptoms are making you really unhappy or uncomfortable. And that doesn't mean that later on, with the help of the lifestyle changes that you will gradually be implementing, that you won't be able to wean off whatever medication you're taking right now, right? There's always the option of this being the medical treatment being a temporary solution until you can make sufficient lifestyle changes to then try to wean off that medication and see what happens. And just make sure that if you do wean off of any medication, you check with your care provider that is okay. But certainly it is something that is doable usually with PCOS, depending on the symptoms that you have and all. So yeah, because the advantages of not just taking the medication, but also of making changes to your lifestyle are that, as I mentioned in previous videos, medication treat very specific things. Usually the meds for PCOS are targeted at specific symptoms. So they won't necessarily treat all of the underlying disturbances that are going on with your body that are usually the cause of your PCOS. So if you can take the meds, but also change your lifestyle and gradually change your habits to have a better diet, to be happier, more positive, exercise more, and just be a better rounded person, then in the long term, you're going to also help reduce the risk of all the other problems associated with PCOS, like, metabolic disorders and all of that. And in the long term, it's just going to be better off for you. And you might, like I said, be able to wean off from that medication, or to reduce the need of further medication down the future. So really ask yourself, what's my priorities? How am I feeling now? What are my symptoms? And then look at your options. Try to read as much as possible. Ask your different care providers a bunch of questions and try to make the best decision for you. And remember that everybody's different, so it's not because somebody else on the internet said that this and that worked for them that it necessarily is the best option for you. It's really a question of you figuring out what works for you.